most common cause of gynecomastia is abnormal sensitivity to the hormones. Normally, the breast gland tissue is not supposed to be sensitive to the grow in men. The breast tissue is only sensitive to the female hormones, which makes the breast enlarged. However, in certain people, there is a hypersensitivity of these glands, and even to the small amount of hormones that are present in men, they tend to respond and tend to grow bigger and bigger, and these are caused due to hormones. There is also a subset of people who take steroids, and these steroids also stimulate these receptors in the gland of the breast, and they cause the breast to enlarge. Now, there is another set of people who have gynecomastia because of lifestyle. Now, when we say lifestyle, the common cause is obesity. Younger people who are overweight and obese with a poor healthy lifestyle, not physically active, we see that they have more amount of gynecomastia. So, the breasts tend to get enlarged, and once it enlarges, it fails to involute. It doesn't go back even when they become adults, after they become 22, 24, 26. The weight they had put on then, they may lose weight everywhere else, along the belly, on the back, on the flanks, but the breast seems to be bigger. Hello, my name is Dr. Srikanth V. What is gynecomastia? Now, gynecomastia basically means male breasts. That means in the male, the breast tends to get enlarged. It may be mild, it may be moderate, it may be severe, it may be to the extent that it all looks almost feminine. Now, breasts are present both in male and in female. However, the male breast is not supposed to be sensitive to the hormone for development at the time of puberty. But in certain cases, in certain people, and even in the certain people in between the one side and the other, for some reason which we with science do not understand, is that they start growing, and they grow to a certain extent, then they stop. And this results in gynecomastia. The other reason why you might develop gynecomastia is if you are grossly obese, especially around the time of puberty. Because what happens is that the DHEA, which is a byproduct of testosterone, which happens in the fat cells, stimulates the estrogen receptors, and the more fat you have, the more amount of this comes out, and it stimulates the receptors and encourages the breast to grow. So, if you are morbidly obese or overweight during puberty or teenage girls, you may find that you have gynecomastia. If you have abnormally sensitive breasts to hormones, you may have gynecomastia. In a small segment of people, take steroids for body development. As a byproduct of the steroid, you will develop gynecomastia. Rarely, in cases of liver failure or testicular failure, you may develop gynecomastia. But gynecomastia, by and large, is idiopathic. That means without a cause, and it happens in quite a significant number of population. The good thing is that it is completely treated. How do you know if you have gynecomastia? This is one thing that is very common. It is fairly straightforward. You examine yourself in front of the mirror. It is obvious to you that your chest wall looks bigger than normal, and it is looking more and more feminine. A lot of them find this out during the pubertal age or in the late teenagers. When they start growing up, they start feeling shy, and obviously children being children, and without being malicious, a lot of people comment about it. People become more and more self-conscious and then realize that they have got gynecomastia. When you come meet your plastic surgeon, he will tell you whether on clinical examination whether you have gynecomastia, and to corroborate that, he may ask you to get an ultrasound done. An ultrasound basically will tell you whether there is a significant amount of gland tissue or a significant amount of fat tissue. It is more of decision making as to where you can expect the surgery to go, whether you require only fat removal or you require fat and gland removal. But yes, gynecomastia is a fairly straightforward spotting diagnosis. You look at yourself, if you feel that the breasts are bigger, then yes, you do have gynecomastia. Now, what are the causes of gynecomastia? The most common cause of gynecomastia is abnormal sensitivity to the hormones. Normally, the breast gland tissue is not supposed to be sensitive to the grow in men. The breast tissue is only sensitive to the female hormones, which makes the breast enlarged. However, in certain people, there is a hypersensitivity of these glands, and even to the small amount of hormones that are present in men, they tend to respond and tend to grow bigger and bigger, and these are caused due to hormones. There is also a subset of people who take steroids, and these steroids also stimulate these receptors in the gland of the breast, and they cause the breast to enlarge. Now, there is another set of people who have gynecomastia because of lifestyle. Now, when you say lifestyle, the common cause is obesity. Younger people who are overweight and obese with a poor healthy lifestyle, not physically active, we see that they have more amount of gynecomastia. So the breasts tend to get enlarged, and once it enlarges, it fails to involute. It doesn't go back even when they become adults. So after they become 22, 24, 26, the weight they had put on then, they may lose weight everywhere else, along the belly, on the back, on the flanks, but the breast seems to be bigger because the gynecomastia, once it is formed, it is not just fat, it is fat and gland, and it doesn't go back. So yes, lifestyle plays an important role in developing gynecomastia, as well as hormones which can cause gynecomastia. Now, teenagers can develop gynecomastia during puberty. This happens especially during puberty because that is the time when the boy becomes a man. There are plenty of hormones as a child which are not there in you. They are going around in your body. These hormones are required for bone growth, for growth of beard, growth of hair, and all this. And in certain cases, especially if the teenagers are obese, they can stimulate the growth of gynecomastia. Normally, the breasts also will develop during puberty. That is known as physiological gynecomastia, and that involutes. That means it goes back. By the time they become adults, the gynecomastia resolves back and they look completely normal. But in a certain small fraction of the population, the breast does not involute and it results in gynecomastia. Most of the gynecomastia actually starts around puberty, proceeds to teenagehood, and by the time they are young adults, it becomes fully manifest. Now, is gynecomastia related to steroid use and medications? Yes, most definitely. Abuse of steroids in male will definitely lead to enlargement of the breast. That is why one has to use extreme caution when using steroids in males. If you need to go to take steroids, please take it under medical supervision because these steroids will stimulate the breast to grow, and once the breast grows, the treatment is only surgery. Lot of youth may get tempted to using steroids in order to bulk up, to build up muscle, thinking that yes, this is only going to build my muscle and it won't do anything to the rest of the body. No, you're wrong. There is a chance that you're giving to cause the breasts to enlarge and result in gynecomastia. Other thing is there are certain medications which can cause gynecomastia. However, they are a small segment. They are quite rare and they are given in very seriously medically ill people. This, whenever you are put on the medication, your physician will tell you that yes, there is a chance that you will develop gynecomastia, and it is my suggestion that if you have any chronic illness and your doctor has put you on medication, it is a good question to ask him, will this cause gynecomastia, will it cause enlargement of the breast? And it is well documented which are the medications which can cause, and I am sure your physician will be able to tell you.